And speaking of addiction, because when you come from learning with veterans, I mean, there's a contextual attachment there that, they've been through conflicts and situations that may cause traumatic, senses for them to become addicted to something later on. But sometimes it's not necessary that somebody has gone through trauma to become addicted to drugs. Can you give us a brief background from your scientific perspective as to, is there any science behind guaranteeing that a person can become addicted or not?
Yeah, there's a lot of science in the addiction field. And kind of what you're speaking to is the nature-nurture aspect of it. So if you have a strong family history of addiction, and maybe you don't experience any significant trauma, you still have a pretty decent chance of suffering from some sort of use disorder as you grow. It's not guaranteed. The environment's actually the most important piece. So if you're raised in a loving, supportive family, you got better odds. But the genetic link is very real. In my experience, and the patients that I work with typically, the vast majority of them do have significant trauma experiences in their lives, whether that's in childhood and adulthood or both. It could be one very significant stressor or many, many over time, but just kind of anecdotally on the ground, most of the patients I see have significant trauma history.
So it's kind of safe to say preventing the trauma prevents the addiction in a sense.
It certainly can, yeah.
And so somebody seeking treatment to get their life back in order, naturally first is the preventative measure of not getting into this mess in the first place. But when they are in this position, where do you tell them to start?
Yeah, that's a great question. When someone is just first seeking treatment, a lot of times they need what's called detox level of care. And really that all that is stabilizing them medically. And that's where you got to start. Once they've gotten some stabilization, maybe 30 days or so of sobriety, and they're on the right medication, that's when you can kind of start working on the trauma history. But even then, it is very early to get into deep trauma work. You still got to focus on maintaining sobriety. It's still very early in the sobriety journey. But you can start teaching some skills on how to deal with anxiety that's directly related to trauma. And PTSD is an anxiety disorder. So you can start teaching them skills to deal with that anxiety that comes along. And after some more time and some continued sobriety, my recommendation always is, after treatment or, getting started during treatment, is to work with a trauma therapist long-term to resolve some of those issues.
Basically, when you talk about rehabilitation, you're talking about a stage when somebody has already admitted to having a problem and wanting to find help or to secure help in some sense, a medical help. But in the opening sentences of this conversation, you said that the drug epidemic is getting much worse now than 11 years ago when you were involved with it when you first started. And I'm seeing this with fentanyl in the U.S. There are, drastic stories of the effects of fentanyl in the U.S. and not necessarily by people who are addicted to it and know about it, but even by people who have absolutely no clue that they became addicted to fentanyl or they just used fentanyl. So my first question there would be, where does a person start to find a way back to rehab? I mean, from that stage of being fully addicted and unaware to be able to shift to a space where I need help?
Yeah, that's a highly individualized question. You hear the term rock bottom a lot. I had to hit rock bottom.
Yes.
I've never really liked that term because you can always keep digging. There is no bottom. You can just keep going lower and lower. But there is a point where at least people start to think about, maybe I need to make a change. Now, it could be years from that first thought before they actually enter treatment. Another misnomer or myth that I hear a lot is that at any given point in the United States, 30 million people have a substance use disorder. But at any real given point, only 10% or less are actually seeking treatment actively for that substance use disorder. So whatever brings them to that point is kind of when they start to think about it and then maybe actually take action. It's different for everybody. Some people realize they have a problem very quickly and get into treatment and nip it in the bud. Other people, they have to go through tremendous pain and suffering and loss before they're willing to go to treatment.